Okay. Thank you for the introduction. Thank you everyone for coming to our session. Again, I'm Amy Montgomery. I'm the Senior Environmental Health Officer for First Nation Inuit Health Branch Ontario region. So I work out of the Thunder Bay office. And this is my coworker, Victoria Chatton. And Victoria is an environmental public health officer that also works out of Thunder Bay. I do not very much field work anymore. I work in the office to support the staff. But Victoria travels to a number of First Nations in the Thunder Bay and Sulikout area. I have a couple other EHO staff in the back of the room. We have Mark and Boo and Kevin Lundstrom, who's a senior EHO as well. So you may recognize them. If not, introduce yourself. So we were asked by the committee, do I have a clicker? Yeah, I do. Here we go. Forgot about that. So we were asked by the committee to provide a presentation on mold, radon, and bed bugs. So it's a lot of information to fit in this short period of time. So Victoria and I tried to do our best to kind of cover the most important aspects of the three subjects, and we want to make sure there's room at the end for questions. And certainly environmental public health encompasses a lot of different natural and man-made things in your environment. So yes, we have a lot of expertise. We're certainly not experts in every single aspect of environmental public health, but I will make a promise to you, if we have any questions we don't know the answer to, that we will get back to everyone today. So our program, again, we're First Nation Inuit Health Branch, and people are aware that we have been moved out of Health Canada into Indigenous Services Canada. We also have changed our name a bit from Environmental Health Officer to Environmental Public Health Officer. So you may be familiar with EHO. A lot of us are referred to EHOs in the community, or water girls, water guys. That's a huge program for us, so that may be how you are familiar with us. So FNHC, I think everyone's very familiar with the community-based health promotion and disease programs. We have primary home and community care services in the communities, environmental and communicable disease issues, and non-insured health benefits. So that falls under our branch. So this is the program that we provide and deliver services in the communities. And we provide services south of 60 in Ontario region. So how many people here are from Ontario? So quite a few. And then how many from out of province? Okay, awesome. So welcome. And when I talk a little more about EHOs, it'll help the out of town people see where their people fit in, because it's different in every region in Canada. And even if you don't fall under us, if you want me to help you find who you need to find in another region, just come and see us after the presentation today. So this program works to identify and prevent public health risks that could negatively impact the health of your community. So the guiding principles of the program, obviously the most important guiding principle is working with you as active partners. So we're here to support the needs of your community and your priorities. Every community has a lack of capacity, I think, in most areas. So we can't come to your community and have a big agenda and expect you to fall into our agenda. So we come to work with your agenda, what's important to you, and what would you like us to have a look at. We collaborate with all sorts of organizations, provincial, federal, municipal, as well as First Nation organizations, departments, agencies, to deliver these programs. And we strive for a level of on-reserve public health that's comparable to off-reserve. So off-reserve, we have in Ontario, we have health units, and then it's different in different regions, health authorities, depending on the province or territory that you're from. But within Ontario, we have health units in municipalities, and they have public health inspectors. So that's what we are, our public health inspectors, but we work in First Nation communities, not in municipalities. So that's sort of our background. Like I said, the name was changed, and that was just when we moved under Indigenous Services. They wanted to distinguish us from their environment officers who deal with contaminated sites. So they didn't want to think they had people doing the same thing, so it distinguished our program. So it's really here nor there. You can call me anything you want, and we'll come and help you provide service to your community. We try to gather data to analyze what steps can be taken. So an example would be within the housing program, we fill out checklists. the data that we collect would be put into our database, and then at the end of the year, our headquarters would tally all that information, and we would look at how many homes have mold, for example, how many homes have this need. So we may try to target some of our promotion in that specific area. The other important thing is using scientific data, right? It has to be evidence-based. So we really strive to determine what is the most recent information that's out there and what is the best recommendation that we can give you. Victoria and I and the group in the back are employed by Indigenous Services, so FNHC, but we also have communities that work for First Nation organizations. So in other regions like Saskatchewan and Manitoba, there's some transfer DHOs, so they work for tribal councils or health authorities. In BC, we had a full transfer. There's no FNHC anymore. FNHC is now the First Nations Health Authority. So that's where your EHOs would be under now, is the First Nations Health Authority in BC. And I think I mentioned we all are certified public health inspectors. We have no authority in your community. I don't have a badge. I can't write you a ticket. I'm there to work with you and to provide you the best advice and guidance that I can. So it's a really good, fun relationship for us that have come from enforcement. Enforcement always isn't fun, and we love working with people, and I think that that's the best way to improve health, is working together. How are we broke up? Not super important for everyone to know exactly where we're located, but there's about 20 of us in the province of Ontario. We do have some transfers that have recently happened. So we have a transfer that occurred with Matawa Tribal Council. So 2 EHOs were transferred, and they provide services to some of your communities. We also have recently transferred services to Kenora Chiefs. So there's 2 environmental health officers that work under Kenora Chiefs now. You would go to them for service, not to us. Very important to note that we work really closely with them. As much as we can, we try to include them in our education and training and keep in contact. And it's a small world. There's not many certified health inspectors in Canada. There's probably a couple thousand. So we know each other, and so we try to keep close and keep in contact and work together. So this is our service boundaries right now. Things change, so I'm not going to point out, you all know where your communities are in Ontario, but this is sort of the 4 dots are where our senior EHO and main office locations are. And core programming. So we're not just water girls and guys. We do a lot of programming, including housing. Drinking water obviously is very important, a huge priority of the Government of Canada, and so we're working as best we can to support the communities that are building new plants or renovating plants. We try to sit at the table and provide advice from a public health perspective. We're not engineers. So we also work with food safety. We do inspections of daycare kitchens, community kitchens, any public facility that your community would like us to inspect, we can come and do that. We can help with recommendations if you're building a new facility, a new restaurant or community kitchen. We can provide you advice how to set that up. Health and housing, so that's what we're here to talk about today. I think a lot of what we do ties into housing. So we talk about wastewater, we talk about drinking water, we talk about communicable disease, landfills. So all of the work we do ties into a healthy community and a healthy home. So we often get called to do inspections. We don't come and say where we're going. We come at the request of the community with their permission. We try to always have a band rep with us. I think that's really important so we see the same thing at the same time. So if you're able to afford your time to go around with the inspectors, whether it's us or building inspectors, I think that's super valuable to be together. Wastewater is another program that we provide guidance and advice on. So septic system inspections, if you connect with us before they go in, and we can help you through the process. A lot of times your contractors are going to say you don't need to tell anybody because you're on reserve, so there's no health unit that's coming to inspect. But we're here for your benefit to protect your investment. So we can come and inspect that septic system and say to you, you know what, the contractor needs to do this, this, and this, or if it's your internal people, we can provide advice and guidance to them. It's really to help prevent that system from failing when it shouldn't and to give you the best bang for your buck. So try to involve us if you can. We want to help you out with that. Also large community systems, we'd provide advice and guidance if there's emergencies or sewage backups or breakouts or things like that. Oh, I'm skipping. Solid waste disposal facilities, I talked about inspecting everything. Communicable disease control, we follow animal bites. That's probably one of our biggest roles with communicable disease. Any animal bite, we'll follow up to make sure the animal doesn't have rabies, as an example. Or if someone got E. coli in the community, we would work with the nursing staff and try and find out how did that happen and how do we prevent the spread. And then lastly, emergency preparedness. So this, some of you may have seen this booklet. This is the one we hand out in Ontario because it talks about the program. Again, if you're from another region, they may have their own tools or booklets that they've developed from your tribal council or health organization. And I'm going to pass it over to Victoria for mold. We're going to try to leave a lot of time at the end for questions. And I'm a fast talker, so don't be shy to ask me if you want me to go over something again. But we want to make sure we can fit in as much as we can today.
Hello, can you hear me? Bad? Good? Speak louder? Okay, cool, awesome. Now where do I click this? Ooh. And the clicker? Okay, the first topic we're going to talk about, the first topic we're going to talk about is mold, and we could probably talk all day about mold. It's a very common issue, but I'm going to just do a quick overview, and especially what we as environmental public health officers see during our home inspections. We're going to talk about what mold is, the conditions for mold growth, the potential health effects, and then more go into what we do as investigations, during investigations, and what we find are common areas for mold growth, high-risk areas for mold growth, and then on to control measures and remediation, and finally about prevention, which I think is the best part, and tips for occupants. Okay, so the first is just a couple pictures of what you may commonly think of mold and not in your house. So mold is just a common term for any fungus that's grown on food or a damp surface. It can be of any color. Usually we see it as maybe black or greenish, but really it can be any color, and it's usually seen as some kind of stain on some kind of surface. And it usually has a smell to it, and what people usually say a musty smell. So what happens is that mold needs moisture and food to grow. So some kind of material that it eats to survive. And once it has both of these conditions, it's able to create spores, and these spores are released into the air, and they are small enough that we breathe them into our lungs. And when we breathe them into our lungs, it can cause health effects to us as humans and impact our health. So the four main conditions that are needed for mold growth are relative humidity, and relative humidity is the amount of moisture that's in the air. So usually 50% or higher, so that's pretty moist air. And then as well as simple moisture. So that can come from anywhere, usually water infiltration, so roof leaks, plumbing leaks, flooding, or condensation. In addition, they need time. So a wet surface is not going to grow mold immediately. It usually takes up to 2 days. And then it also needs a food source, like I said. And in a home, it's usually your soft surfaces, like, or not your metal, but your drywall, cardboard, insulation, wood, fabric, that it usually sticks to and likes to eat as food and grows on. Now, what are the potential health effects? I know they've been talked about a bit today with our doctors, and I'm not a doctor, so I'm not an expert, but it is well associated with respiratory issues, so eye, nose, and ear irritation, coughing, wheezing, shortness of breath, symptoms of asthma, and some people can have allergic reactions. And what it's important too is that people can have different reactions. So even in the same house, someone who may be immunocompromised may have a more severe reaction than someone who is not immunocompromised. So it can react differently to different people, and if you're allergic, you may be more sensitive to it than another person. On to investigation. So what we do as environmental public health officers is we usually get called sometimes from the housing department, sometimes from the band, sometimes from the health department, community health representatives, sometimes from occupants themselves. And we're asked to go in and inspect a home, and usually the reason is mold or indoor air quality. So this is a picture of me doing a housing inspection. And what we're looking for is the source of moisture that's causing the mold. So was there a leak? Was there water infiltration? And we're going to go through that a bit in the next slides. And what you've probably heard of too is sampling. But we don't do sampling, and Health Canada actually doesn't recommend sampling because sampling is not going to tell you what caused your mold. So it's not going to tell you, oh, there's a leak here, this is the source of water. It's just going to tell you that mold is there. And we say any mold is bad mold, so you want to get rid of the mold either way, whether or not it's sampled or not. So the best way to reduce your health risk is to identify the source of the mold and then just remove the mold itself. So here are a few pictures. Do any of these pictures look common to you that you've seen in your community? You can raise your hand, like ceiling leaks like this that cause mold, or venting or exhaust venting not connected properly, or bathroom seals, or lots of mold can grow in bathrooms underneath or beside the tub seal, or underneath behind the toilet, or underneath the bathroom sink. That's a very common area. And we're going to go through these a little bit further. And not only the inside of the house, we look at the outside of the house too. And these are the most common aspects that lead to water infiltration, especially in the foundation. So a missing downspout. How many of you have seen missing downspouts in your community? Common, yeah. Very common. We see this all the time. So if the downspout is missing, where is that water going? The water that's being collected in the eaves trough is just going straight next to your foundation and potentially entering into your foundation. We recommend that downspouts are extended at least 2 meters away from your home so that the water is directed away from the home and not directly back into your home, into your foundation. Same with the perimeter of the house and perimeter drainage. And I believe Jonathan talked about this the first day of talks, is that if the foundation is sloped towards the house, any water runoff is going to come again towards your foundation and potentially penetrate your foundation and make your foundation wet. And what we recommend is that the ground is sloped away from the house. So any water coming close to your house is being directed away and it's not going into your foundation. Next, windows. We very commonly see mold growth on windows, and this is due to condensation. So condensation happens when there's moist, warm air, and it contacts a very cold surface. And once that moist air touches the cold surface, the water condenses from the air, turns into water, and then the water is on your window, which causes mold because the moisture is there. So we recommend occupants being aware of this and cleaning up any water or moisture that they see on their windowsills. If you see water there, dry it out, as opposed to just leaving it there and waiting for the mold to grow, okay? Next, very common, water leaks in plumbing. So we see mold growth underneath kitchen sinks, underneath bathroom sinks. And what is the likely cause? A leak in that plumbing, in that sink. So again, something that could be an easy fix is being aware of leaks, reporting the leaks, ensuring that your occupants report the leaks to whichever department is responsible, housing department likely, and that's being fixed before it's a big issue. So if leaks are fixed as soon as possible, there's less chance of mold growth. Last big pictures here are venting and exhaust fans and vents on the inside and outside of your house. So bathroom fans and kitchen fans can get clogged. Has anyone ever seen a clogged bathroom or kitchen fan? Does anyone clean their bathroom or kitchen fans? Good. So yeah, they can get clogged with dust, debris of any kind, and should be cleaned regularly. Because if they're clogged like this, the moisture from your bathroom or kitchen is not able to escape through the venting, and it will just come back into your house. And same with exterior exhaust vents. So the bottom one is an HRV inlet. Sorry, that's the inlet. But that's intaking clean outdoor air, and that's clogged. So it's not able to bring in that clean outdoor air into your house if it's clogged. So doing a perimeter check of the house and making sure these vents are clean and not clogged. Same with dryer vents. Dryers take away the moisture in our clothes, and if they're vented properly, are going to the outside your house. And if they're clogged like this, the water and the air is not able to escape. It's going to come back into the house. So these are also common things that can be done by the occupant or the housing department, whoever is responsible, so that water is escaped properly and not coming back into the home. Next, so control measures and remediation. I'm not going to talk too much about this because I'm not a remediation expert either. But the first biggest thing when we found out that there is mold in a home is to find out the source of the water or the moisture that's feeding the mold, and to fix whatever that is. So if it is a plumbing leak, if it is a roof leak, to identify what the source is and fix that first. And once we've done that, then we can remove the mold. But if we're not going to fix the issue, even if we clean up the mold's going to come back because the water is still there or the issue is still there. So what's really important is to identify what's causing the mold growth, what's causing the moisture. There's got to be some kind of moisture coming into the house to cause the mold. And again, what's really important for mold cleanup, so once you've identified the issue and now you want to clean up the mold, is to make sure you have proper protective equipment. So which includes some sort of breathing mask. Usually we recommend N95 or better. Safety goggles or glasses, gloves, wearing long sleeve shirts and pants. And even with these precautions, mold spores are airborne. So when you are doing cleanup, it's important to make sure immunocompromised people and children are not involved in the cleanup and they're away during that, because it can kind of increase the spores in the air. So there are CMHC recommendations, and we've had them at our table yesterday, and I'm sure CMHC had them as well, with recommending remediation or cleanup for different sizes of mold. That's how they determine. So the first is a small area of a mold, and I'm going to actually show. So small area of mold. This is a small garbage bag, but small area of mold is 1 square meter. So it's about this size. So anything this size or smaller in a stain can be done without a certified mold remediation specialist. So it could be done by the housing department or an occupant themselves. And with this, we recommend, again, proper protective equipment, what I just mentioned. And then you can just use simple dish soap and water to clean the area. We don't recommend any type of heavier chemical like bleach, because chemicals and mold altogether can be harmful for the health if they're not used properly. And anything that's too wet that can't be cleaned properly is recommended to just be tossed, because it just can't be salvaged. And then the CMHC documents go into medium mold, medium areas of mold, which are between 1 square meter and 3 square meters. And this is more using your discretion on whether or not an untrained professional can do it, or if it's too big that someone certified in mold remediation needs to come in. And that's when a large area of mold, so 3 of these, this is 1 square meter, so 3 square meters of this or larger, it's recommended that someone certified in mold remediation comes and performs that cleaning up of the mold. Does anyone have anyone trained in their communities that are mold remediation specialists? No one. Did you call people in ever? People are shy. So yeah, large areas of mold, we recommend someone come in. And again, these people are trained professionals and know the proper protective equipment and know how to handle mold material. The next, which I call the best part, is how to prevent mold and what kind of tips can we communicate to our occupants and our whole housing departments. So the first, like I said, is once you see water, once you see a leak, act quickly. So if you were to do your own type of home inspection, checking the foundation, the walls, the windows, roof, plumbing, bathrooms, so around the tubs, seals, for any water leaks. If there's water leaks, that's an indication that mold could grow later on. So fixing up that water, or wherever the leak is coming from. And then what we see again, condensation on the windows. So making sure people are aware of that and cleaning up the water before the mold can grow. And drying the surface, cleaning up the water and making sure it's dry so that mold doesn't grow. Next is ventilation. So ventilation is very important to removing the moisture in your home. So, I don't think I mentioned this earlier, but a family of 4, just by breathing in a week, can create 40 liters of water into the air. So that's about 10 of these. This is a 4-liter milk jug. So 10 of these a week for a 4-person family home. So if 8 people are living in a home, that's 20 of these a week, just by breathing. That's not including cooking, showering, cleaning up with water, mopping, or having drying clothes inside the house, or having wood built up. All these things create moisture in your home. And if you don't have proper ventilation to remove that moisture in the air, it'll stay into the home. And where is that moisture going to go? So making sure that you have some kind of ventilation in your home, whether that's bathroom and kitchen fans. And if you have those, making sure they're turned on when you're taking a shower or cooking, and making sure they're left on even after the activity is done. We say at least for probably 30 minutes. So after showering, the bathroom fan is on for 30 minutes. And then making sure just that your ventilation ducts are connected properly, and that they're exhausting to the outside of the house and not coming back into the house. Commonly I see dryer vents that are just going straight into a crawl space. So all that moisture that was in your clothes is now in the crawl space. It's not coming to the exterior of the house, and that's creating a moist crawl space. So being aware of proper ducting and where your exhaust vents are going. And then if you can, when it's practical, I know in the winter it's not really practical, but opening windows to create that air ventilation or passive ventilation of the moist air from the inside leaving to the outside through an open window. Oh yes, and lastly, HRVs. So if you have an HRV, turning it on, those are really important and help with removing moist air inside a home and replacing it with fresh air from the outside. Another way to prevent mold is just keeping the home dry and warm, and having good circulation in the air. So what I see often is a lot of bedroom doors are closed, and people tell me, oh, that room gets really cold. Well, if a room gets really cold, it's only going to get colder if the door is shut. So opening that door and making sure the air circulation is flowing throughout the whole home. If a bedroom door is closed all the time and it's cold, that's when condensation can happen and moisture can land on those surfaces in that home, in that room because it's cold. Oh yes, and keeping furniture away from exterior walls. So those are also cold walls. So we want to make sure the heated warm air is able to circulate throughout the whole bedroom and the whole room, and that if a big bed or a big couch is pushed up against the wall, that can be an area where mold is grown if the warm air is not able to pass through that area. Next is removing items that cause mold. So removing stored items that are in crawl spaces or basements, especially if they're in cardboard. So cardboard, mold likes cardboard. It's easy for mold to grow on cardboard. especially if it's moist. It's easy for cardboard to get moist too, as opposed to a nice plastic bin. But either way, we don't recommend anything to be stored in a crawl space. That's not meant for storage. If anything stored into the crawl space becomes wet, it's such a high place of mold growth. And then removing anything that is damaged. If you do have a flood and it's not repairable or not salvageable, to get rid of it, because that's only going to grow mold later down the road. Next, not storing firewood in the home. So they say 1 cord of wood can produce up to 270 liters of water. So it's a lot of moisture coming into your home, along with other things that can be on the wood too. We just recommend wood being stored outside the home. And removing any carpets that are in moist rooms, or switch our basements and bathrooms and kitchens. Sometimes we see carpets in there. Those can stay wet for a longer period of time than hardwood floor, and so removing them because they can be a source of mold growth. And lastly, removing clutter and garbage. So making sure we're taking out garbage regularly and removing clutter in the house. The more clutter that's in the house, or the more stuff that's on the floor, or just all around in the house, there's not proper air circulation be able to go through all those rooms. So removing all that clutter will help the warm air circulate better. And lastly is the exterior of the home. And like I said, making sure you're installing proper downspouts and that they're extended properly, to making sure that any rainwater or melted snow is being directed away from the home. Making sure that the eaves are clean and maintained properly, and then making sure the slope around the perimeter of your house is graded away from the home and not towards the home. Next is radon.
Sorry, the microphone's the hardest part, I think. So thanks, Victoria. She did a great job talking about mold and prevention. And she really talked about ventilation. So ventilation is going to be another common topic in this concern that we're seeing in radon. Before I get going, everybody's looking a little sleepy. After lunch, we're on the last day. Just wondering if I can get an idea of the type of the groups of people in the audience. So how many are housing managers? Okay, counselors. So a few counselors. Maintenance or contractors in your community. You guys do the work, right? Get down there. So we have a really good variety, I think, of people in the room. How many of you have heard of radon? A few people? Good, that's good. So radon is something that I think we're going to hear more and more about. And our program has been involved in some radon sampling with the First Nations in Ontario region. I guess we'll talk about what it is. Radon is a radioactive gas. I'm by no means an expert in the periodic table of elements. I know quite a few of them, but when we talk into the decaying chain of uranium and stuff, I'm just going to kind of briefly talk about it because it's quite in-depth and I don't understand all of the alpha-beta particles and how it works, but we're going to talk about uranium turns into radon and how does that make you sick, and then we're going to talk about how to prevent that. So it is actually a naturally occurring gas. It's the only gas that's formed when uranium breaks down in soil and rock. So it's a common element on the earth. It's found everywhere and everywhere on the earth's crust. So none of us can get away from it essentially. When uranium breaks down, it goes through this decay chain like I mentioned. So uranium goes to radon, which is what we're concerned about, the Rn222. You don't need to know this, but it's nice to have a bit of background about how it works. And then you also have another daughter of uranium, and that's polonium. But radon is the one we're concerned about. So in the dirt under our feet, uranium starts to break down, and it turns into radon, and it has a life of about 3.8 days. So once it turns into that gas, what happens to gas? Where does it go? Up, right? So once it starts to release out of the soil, it's going to go up. In Canada, it's measured as becquerels per cubic meter. So I talked about the breakdown of it, how it starts to decay, and then we get a gas. So the gas actually easily moves through permeable soils like gravel and sand. It also will travel through water, which is really interesting. So if you have a well or a lake, the radon is traveling and escaping through there. It can come out of your well. It's released into the atmosphere constantly, continuously at a rate of 10 to 15 becquerels per cubic meter. So what that means is every day you're walking around and we're exposed to radon. So radon is like a mold spore, right? We're exposed to it in the environment. It's not at a dangerous level because it's diluted by natural air and oxygen. But if we allow it to get in our home and we don't ventilate it out, just like mold spores, then we can have a problem. So how does it enter your house? So once it goes through its breakdown into the radon gas from uranium in the ground, you have cracks and opening and gaps. How many people have a crack in their foundation? How many people have gaps in maybe their crawl spaces or tiny little holes or screens that you can see light coming through? You've seen them in other homes. So we all have perfect homes, right? There's a lot of things that you need to take into consideration. We also know that the air pressure inside your house is lower than the pressure outside. So what does that mean for the gas? Where's the gas going to go if it's released outside or under your home? Again, it's going up and it's being sucked like a vacuum into your house. So the difference is that the vacuum draws the radon in and it actually is going to pull it through this fractured bedrock, or it's going to pull it through your well. If you're on, some people are on decentralized systems, so there's a lot of communities that have wells. And so they're going to pull, the radon gas is going to travel up their well and it can get into their system through their shower, through their kitchen sink, any cracks, windows, sump pumps, all of these sorts of areas that we can have it enter the home. And then once it's in the home, it builds up to a level that's dangerous. And what level is dangerous? Well, again, we try to look at the most recent scientific evidence or information that we have access to. So we would look at Health Canada recommendations, and we're going to talk about that level. So what actually affects radon in your house? So obviously, if I have one crack in my foundation and my neighbor has 5 cracks in their foundation, they may have more radon gas entering their home. If my sump pump is sealed and closed properly and my neighbor's is not, odds are they may have the gas entering that way into their home, whereas my home right next door doesn't have it entering. So the amount of uranium in the ground, and again, we're going to talk about a study that they did across Canada, which they've said none of us are free from radon. It's there. Everywhere across Canada they looked, they found radon. It's not at a dangerous level everywhere, but it's there. So the type of soil and the moisture in the ground, right? Because if you have bedrock that's perfect and beautiful and has no cracks in it, then it's not going to move. But if you have nice sandy soil or gravel under a home, which lots of foundations have gravel brought in and put under their home, so it's easily accesses the inside of the house. The design and construction, the number and size of openings, heating and ventilation. So if your home was designed with an HRV unit, and I know a lot of people unplug them because of electricity. There's a lot of concerns with HRVs. They're not perfect. We understand that. People unplug them because, especially elders, because they feel drafts. When it's this cold, they feel drafty when their HRVs are plugged in. Because again, like we live in the north, and when it's -40, the HRVs probably don't perform as well as they do in -20. But the good news is there's a lot of work being done at CMHC, and other organizations are studying these units. Research like Dr. Kavesi is doing is going to feed into how do we improve ventilation in communities. If HRVs aren't the answer, or they are the answer, how can we better design them to work in a northern climate? So hopefully we see lots of new and exciting research coming with those units or other types of ventilation in a home. Occupancy patterns. So I think that's really just dependent on how many people are in the home. How many times are you opening and closing windows? You know, shut the door. Were you born in a barn? Like my mom always yells. So again, it depends on the people in the home. If you're busy and people are coming and going all the time, then they're out opening the doors and allowing for more entry into the home. If they're showering, if they're not putting on fans, all of those things will contribute to the amount of this gas in your home. So this chart, it just shows you that long-term monitoring is recommended. We don't recommend that somebody comes in and puts a test for 1 week and tells you what the level is. And the reason is because all these factors come into play. Especially in the north when we have conditions in homes where there's overcrowding. So we want a representative result. You want to know what really is the highest average radon level in that home, right? So you want to do it, they recommend over 3-month period. What's the best time of year to monitor for radon? In the summer? How come? People are saying no, not in the summer. Pardon? Ground's not frozen. Yep, that's a good point. What do we do in the summer with our windows and doors and screen doors? We tend to open them more, so the radon will get out. It's not telling you what the worst case scenario is. I want to know, or you want to know, when your family's in that home in the dead of winter, the doors are open the least, the windows are open the least, what's the highest level they're exposed to? So we recommend winter monitoring over a 3-month period. So we talk a lot about what radon is. It's a gas, it breaks down, it can get into your house. But what does that mean to you or to your community and their health? That means that it is a very concerning contaminant, environmental contaminant, because they know it develops lung cancer. They know 100% radon causes lung cancer. 10% of lung cancers across the world are attributed to lung cancer. In Canada, it's 16% of lung cancer deaths. So that's quite significant. Now, the other things to consider is that you're inhaling it. And again, it's a very complicated process about how the particles of this broken down material get into your lungs and jump around and do damage. And Dr. Kavesi might be able to help us if we want to really talk about how it damages your lung. But it does. It gets in there, and prolonged exposure over certain levels are going to cause damage that can result in cancer. So this is very serious and something that we want to have on our radar. So the risk of developing lung cancer depends on how much radiation or radon are you breathing in. And it also is how long have you been exposed. So how long have you been in that home? How long has your grandma been in that home? Or a certain family? Have they been there for 1 year? Have they been there for 25 years? The other terrifying health effect is the combination if you're a smoker. So if you are a smoker and you are in a home that's exposed to levels above the limit with radon, they say that your risk goes up to 1 in 3 for lung cancer risk. So again, here, just a quick look. So the government recently changed the level to 200 becquerels per meters cubed. And again, it's a number. I'm going to show you a picture of the monitor you put down. You're going to get a lab report back, and we're going to have a number. So this number on the left is the level of radon that they've measured in a home. If you were a non-smoker, your risk of getting lung cancer with those levels of radon would go, like if you had no background regular radon, 1%. If you have 800 becquerels per meters cubed in your home and you're a non-smoker, now you're at a 5% risk for lung cancer. But if you smoke and you're in a home that has an exceedance, this is huge consideration. So the guideline was changed in 2007. They took it from a higher number that they said was safe, and they're saying, no, 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 we're bringing it down to 200. We need to lower that number, the number we used previously. There's new information, new scientific evidence. So they've decided that we are looking at concentrations of 200 becquerels per meter cubed. So essentially they set up the guideline that most people are in their home for more than 4 hours a day. Well, on days like today, I can promise you most of us, if we're not working, are in our home probably more than 4 hours a day, right? So all of those factors are going to affect your exposure. How do we test? So we talked a bit about long-term measurement, and you want to make sure that it's over a minimum of 3-month period time. Now you can hire a radon measurement professional, or you can talk to your EHO. We can help you. We have guidelines that we're given. We can let you know where to set up these units and how to set them up. There's certain recommendations for the height of the unit, the type of room that it's in, for example. If you have an office a band office that's in the basement, then that would be a place we'd want to test, right? Because the band employee's in the basement and they're probably in there for 8 or 9 hours a day. So the guideline helps you determine the riskiest areas in your buildings or in the home and where you should test. You can purchase the kits. They're all over online, on the phone. There's all kinds of retailers. I think like C-Tire and Walmart and all of those retailers carry this type of product. So you want to shop around. You don't want to necessarily run to radon specialists because their cost may be a bit higher. Shop around if you're doing a bit of work. You can have a radon professional come in. I would suspect the cost is quite high, but if you were working on some type of proposal or something of that nature or project in your community, you could look at that. We've talked about long-term monitoring, how that's more important. And these are the examples. I don't have any experience with the top two, but we use the alpha track detector. Did anyone from Ontario remember seeing an alpha track detector a few years back in any of your buildings? No? So Dr. Kavesi saw them. He probably knew what he was looking for too. So these are small, like this big. They don't stand out, which is good. You don't want to like freak people out with some big giant monitoring device that has like radiation symbols on it. You want it to kind of be off to the side so you're not panicking everybody. You're gathering the information you need, and it's not going to get lost or bumped. It's not in your way. It's not a big piece of equipment. So this is what we are mostly have used when we've done our monitoring. So the limits now, if your results for a home or business come back 200 to 600, the recommendation is fixing it within 2 years. If it comes back above 600, the recommendation is within 1 year. How do we reduce our radon levels? So if it's found high, there are all kinds of reasonable measures in most cases that you can get support to fix, for example. So it could be as simple as having the HRV unit on and having the occupants utilize their fans and their ventilation system. But it may be a bit more difficult. Did anyone talk to the radon people that were in the room yesterday? Good. So we had a couple people. So there was a radon abatement table in the competition room, and they had some diagrams, and they talked about how they reduced radon in homes. So there is a certification for people that do radon. So it's just like mold. If you have a home that you've sampled and you end up in a position where you're above the guidelines and need to remediate, then if you're going to bring in a specialist, you want to bring in somebody. This acronym I forgot to type out for you, so I'll tell you it's a Canadian National Radon Proficiency Program. So contractors will go. It's very extensive testing and courses they have to take to learn about it, and then they become certified, so then they can provide that service to people to help remediate homes or businesses or buildings. So how else? Probably the most common, and I'm not a contractor and I don't build homes, but the most common devices are using are depressurization devices. So that way you are, you can do simple things like you put a fan in your home. It might be as simple as they come and cover your sump pump. Maybe you already have nice poly. It could be as simple as installing a fan that goes from basement out through the attic. So they have all sorts of different methods they can do. Like if you were only slightly over the guideline, then maybe there's less cost measures that can be taken to achieve the same results. Whereas if you had a home with very high amounts, then you may have to take a little more measure to make sure that that home is protected. So the big ventilation that Victoria talked about is the use of the air exchangers and HRVs. And it can be as simple as just running your fans. Like if your HRV is not working, put your bathroom fan on and leave it on all the time. Anything to keep the flow of fresh air being drawn in from outside and pushing that air that we've been breathing all the time that could be contaminated with radon, you want to get it out of the house. Sealing the entry routes, as simple, we all had cracks in our foundation, so it could be as simple as going and, when you get home, having a look at what you're dealing with now, and you could start very simply protecting your family by sealing anything that needs to be sealed. So active soil depressurization. This is a simple example I showed you. They would install a pipe and a fan that draws radon out from under the ground, and they push it out before it can even get in your home. We are usually seeing a 90% reduction. Has anyone worked with a radon abatement company? So I think this is something that's more new in the last 10 years. Like I've been working with communities for a little over 10 years, and this is something that we really started to see in the last 8 years. So there's more and more radon concerns coming up, and I think that we're all going to see more activity in this area in the next few years. So Health Canada did a survey of homes across Canada. They released the study, I think, in 2012. You can look it up online. It's quite interesting. So 14,000 homes across the country were sampled for radon, and what they found is 7% of homes exceeded the Canadian guideline. Pretty significant. If I was one of those 7, I wouldn't be too happy with that, right? Concerning. So 7%. Now, 95% of the regions that actually participated had homes above the guideline of 200 becquerels per cubic meter squared. So what does that mean? 95% of every province and region that participated had radon. So like I said, they've told us it's there, it's in the ground. So we know that none of your communities are free from radon gas. It's the home that keeps it out and keeps you from having it build up into a concentration that's not safe. So my home could come out at 800 becquerels, and your home could come out at 90. And they're the exact same homes built 20 feet apart. So you cannot make assumptions because one home is low that everyone else is going to be low, because it's dependent on all those factors that we kind of talked about. How many people, time of year, how many cracks, how many openings into the home. So this 7%, I'm just going to skip this one, kind of tied into the work that we had done in Ontario region. So we had sent out a letter, anyone that saw Sean at the panel discussion, he's my regional manager, so we send out letters to communities asking if they want to participate in public building monitoring. We had a number of communities that came back, and we tested 75 public buildings in 14 communities across Ontario. And for the 75, we were looking at about 4% that tested over the 200. So that's pretty close to the 7% that they found cross Canada off reserve. So we know radon's there. And there are homes that are going to exceed that level. What did we do? We supported the bands when they got high results. We worked with them with a specific building, and we tried to help them determine how to remediate. So the communities themselves would work to remediate, and then we would go back and retest and verify that the remediation worked. So it might take 1.5 years or 2 years for the whole cycle by the time we go back to retest, because again, we don't want, even if they do the work in the spring, we don't want to do long-term monitoring in the summer after the work's done, because we know the highest radon is going to be in the winter. So let's wait till the winter, we'll do the monitoring again, and then we can verify the work that they did removed the radon. And if you hire a specialist, they should be doing that. They should be able to prove to you that that home is safe now that they've done that work. So the Building Code of Canada, Jonathan Gregg talked a bit about this too when he talked about his inspections. Polyethylene gas barriers, so you can start to do this now with new builds, is making sure that you're putting, if you have poly use in your crawl space, then maybe you want to bring the one in that prevents radon from passing through, for example. Cost is higher, but with new housing and new builds, the changes were introduced to the building code. Is there any building inspectors in here who knows radon? So have these gone through the code yet, or are they still in?
So as part of the code requirement, you set it up like underneath.
Yeah.
But without setting up the system, you just prep it so you can hook it up.
Okay. So you don't actually hook it up. Okay. So it is in the code. It's in the National Building Code, and he was saying that if you do the fan system.
Right, it's not the fan itself, it's just the pipe.
Just the pipe. So they put the pipe in now in the foundation when the home's built, so that in the event you need to get that depressurization system, it's ready to go, and you don't have to break open your foundation and put it in, right? Okay. So if your community's standard is National Building Code, then that would be something with new builds you would do. If you're looking at renovating, then maybe you would look at this type of barrier. Again, making sure all your pipes are sealed and the sump pits are covered and required to be airtight. And again, this ties in with Victoria's recommendations to prevent mold growth. So these are all positive things that can be done at the home level. So what is our role now? I wish I had news that we were rolling out a housing survey. We're not at this time. I have not got any information about that. So at this point, our role would be, if you want to sample or survey your community, we'd be more than willing to sit down with you and help you with your testing approach and units to buy and when to do it. And once you deploy the detectors and pick them up, we can help you with the lab submissions and that sort of thing, and providing advice and guidance. So unfortunately, we have no plans to sample homes at this point, but again, I think this is an issue where we are only going to see it rise. And if anyone wants more information, please feel free to come and chat with me after. And I know this one is a big one, so everyone's excited to talk about this one.
Okay, yeah, the most exciting topic, I say, why everyone's maybe here, bed bugs. I'm sure everyone has heard of bed bugs and are probably quite afraid, but I'm here to teach you so you're more knowledgeable about their activity, how to prevent them, what to look for, so that you have less fear and that you can do these proactive things to prevent an infestation happening in your home or your community. So who saw in the booklet, there was a little, everyone got the main booklet for the event, there's a little insert about bed bugs. And so what you can commonly do when you're traveling is checking for bed bugs in your hotel room, specifically in the mattress or in between the mattress and the box spring, but there are other areas in that insert that tell you to check, and you can check for those. And also, if those of you who didn't come by our booth yesterday, I have bed bugs here. They're not alive. So we can hand them out, actually. If you can pass them along. There's only two, there's one vial and then one in a tape insert. So have a checkout. You can bring out your phone if you want them more light, but just so you're aware of the size of them and what to look for, because some people haven't seen them up close. We're going to talk about the history, biology, activity and signs of infestation, treatment control, prevention, and then finalizing in prevention strategies for housing departments, and ending with the social impact or the social stigma of bed bugs. Okay, the history. So around 1950, they thought bed bugs were eradicated. They were using a pesticide called DDT that was very effective. However, there are health concerns, major health concerns with DDT, so that was stopped. And so after that, and with some resistance to DDT and some other pesticides, bed bugs grew in number. In addition to the increase in global travel, how accessible it was to travel from different areas, that's how easy it was for bed bugs to travel too. So the issue of bed bugs has expanded all over the world. In addition to the increase in the interest in purchasing secondhand items, has also increased the potential for bed bugs. So the biology, what's really important is to know what they look like. Lots of bugs look similar. So bed bugs, I say they look like apple seeds. They're kind of an oval shape. They're usually dark brown, rusty color. They can be deeper dark or deeper red in color if they've just fed or just had a blood meal. They only feed on blood, so there's no other food source for them, but they can feed on humans and pets. They cannot fly or jump, so that's really important. A lot of people are nervous that, especially housing departments, potentially if you're going to investigate if there's a pest control, or if there's a pest issue, and you're worried about bed bugs jumping on you, they can't jump on you, nor fly. They physically have to crawl on your shoes or on your bag to actually be traveled with you. More about their biology, their life cycle contains 3 stages: eggs, nymphs, and adults. Nymphs are a little bit smaller than adults and usually clearer in color, so they're more transparent. And eggs are white or whitish color and very, very small, only about 1 millimeter. And the bugs themselves are about 6 millimeters. So this is an up-close look of what a bed bug looks like. So 6 legs, antennas, but antennas aren't too long, and that oval shape. These are common lookalikes. So we sometimes get bugs sent to us for identification. And common lookalikes are fleas, although fleas can fly, book louse, along with lots of variations of beetles. But it's good to know the difference. But that's hard. Sometimes it can be hard to identify. This is the life cycle of the bed bug. So there's 3 stages, but there's 5 or 3 eggs, nymphs, and adult, but there's 5 stages total. There's 6 stages total, 5 nymph stages. So in between each stage, the bed bug has to have a blood meal to molt into the next stage. And nymphs can live around 3 to 6 months without a blood meal, and adults can live as long as 1 year without a blood meal. Females can lay up to 200 eggs in their lifetime, about 2 to 4 per day, and the eggs hatch within 6 to 10 days. So you can get an infestation to grow quite quickly if it's not taken care of early. So their activity, they don't wander far from their food source. So they're going to stick close to humans and where humans spend the most time. And that's usually in our beds. We sleep there for 8 hours. They're most likely going to be very close to the bed, on the bed. Other common areas are a couch. If someone were to spend a lot of time on a couch or living room furniture, they can also be close there if a human is always around there. They usually feed at night, so they're usually more active or always more active at night. So you may not see them crawl around during the day, but then at night that's when they like to feed. They are attracted to the carbon dioxide that we breathe out, so that's how they know we're around. That's how they know where we are and like to stay close to us. And like I said, they can feed on pets, so they can be on your pet beds, on your pets themselves. They like to hide in dark places, so you may not notice them right away. That's why usually they're in between the mattress and box spring, or behind a baseboard, or behind a headboard of the bed. They're not usually out during daylight. Unless you have a large infestation, then that's when you may see them out in the light. And for activity, how they get from one place to the other is they hitchhike. So they crawl on your clothing or on your luggage or your bags, and that's how they're transported from one area to the other. So how do you know if you have an infestation, or how do you know if you have bed bugs? The first sign people usually maybe notice are bites. Now, bites are usually painless, quite small, but they are visible. Some people don't report any reaction, and most bites heal within a week, unless they're scratched aggressively, and then they can lead to secondary infections. But it's very difficult to diagnose that you have bed bugs based on the bite, because they look like any other insect bite. Mosquito bite, spider bite, they don't have a unique bite look. But are they harmful to humans? Bed bugs are not associated with a physical health hazard. There's no evidence that they transport any diseases or any bloodborne diseases like HIV, hepatitis B, or hepatitis C. Although they can cause or involuntarily cause secondary infections if someone's scratching their bites quite a bit, and then they have open wounds, which can lead to secondary infections. And some people can have allergic reactions to their saliva. The next sign of infestation is actually visibly seeing the bug. So this is a picture of a bug, and if you do see a bug, we recommend either notifying your housing department. If you are a housing department, you can send it off to your EPHO, and we can identify whether it's a bed bug or it's a different type of insect. So putting it in some kind of pill bottle or glass bottle and send it to us, and we can identify. But next to the bugs themselves, you may also see dark spots visible on the bedding or furniture. And this is from their droppings, usually dark brown, almost black in color. You also might see blood stains from when they bite you, or when bugs are being crushed in between the sheets or in between the bed and the box spring, you may see blood. Also, some people do report a sweet, musty smell with bed bugs. Although I've never experienced that smell, some people smell it. So where to look for bed bugs? They can be almost anywhere, but the most likely space, if you have a small amount of bugs, is usually going to be on the bed. So in between the seam and the mattress, in between the mattress and the baseboard, or in between the baseboard and your bed frame. But there's also other areas, especially if you have an increased amount of an infestation. They can be on the floor, between floor clacks, behind the baseboards, behind electrical outlets. They can be inside vents that are on the floor. They can also be, again, in your living room if you have couch or upholstered furniture, inside the box spring or inside the mattress themselves, on bed frames, on blankets, headboards, like I said, pet bedding, or potentially underneath drawers. This is not a very good picture, you can't see it quite well, but this is just various life stages and where it's easily found. So this is the seam of a mattress, and where you can see dark spots would be the excrement, white spots may be the eggs, and then the large rusty brown could be the bugs themselves. Again, this is just another picture of bed bugs, mostly all the adult stage. These are larger infestations, very close up. Again, you can see the various colors. Dark spots, excrement, white are the eggs, and the larger rusty brown are the bugs themselves. So you can find them all together, all in close proximity. So this is a really bad infestation, like I said. Again, further, quite a large infestation along a mattress or along a bed frame. Again, you almost can't even tell the difference. It just looks like a big mess. But yes, there are various stages of life within that picture. Okay, so once you've noticed that you have an infestation, what do we recommend? And we usually recommend to contact a licensed pest control company. These people are trained professionals and know and have the experience of what methods to use to get rid of the bugs. They can be difficult to get rid of, and so sometimes repeat applications are required. So sometimes the pest control company has to come back. Again, they'll use heat, chemical, or steam, or sometimes biological ways of reducing the bed bugs. What happens is when a pest control company comes in, they will give the occupant preparation instructions, and everyone should follow that. Usually it's bagging items up just to make sure that your personal items aren't affected by the chemical, or whatever needs to be treated is treated correctly. But going through prevention without using a pest control company, there's some things that you can do within your community or communicate out towards your community. So first one is not bringing in secondhand items, or if you do, you're inspecting them thoroughly. Same with clothing. If you're accepting secondhand or going out to buy secondhand clothing, washing them or inspecting them quite well before you're wearing them, before you're putting them in your closet. Heat is a very effective treatment in killing bed bugs. So heat with 50 degrees Celsius or higher will kill all stages of life. And so we say if there's any fabric material like clothing or bedding that may be affected by bed bugs, to put it in the washing machine on the hot cycle and in the dryer at the hottest setting for at least 30 minutes. Another tip is when you're traveling, to leave your luggage bags or your personal items in the bathtub. So bed bugs can't crawl up the slippery surface of the bathtub. And so this is a great place to put them either when you're traveling or when you're coming back from traveling, before you unpack, before you wash all your clothes. It's a safe place to put so that the bed bugs don't crawl into your bedrooms. They can't crawl out of the bathtub. Again, washing your clothes after you travel. So once you go travel somewhere, a good prevention method to make sure you're not bringing them back is washing all your clothes that you wore out when you're out traveling, washing your bag if you can, so that you're killing any bugs that may have traveled on your clothing or on your luggage or bags. And lastly is minimizing clutter. So like I said with mold, but on this side, minimizing clutter reduces the hiding spots for bed bugs. If we have things all over the floor, especially in our bedroom, those are easier places for bed bugs to hide. If we clean all that clutter up or remove all that clutter, there's less places for bed bugs to hide, or they're more easily identifiable as opposed to hiding beneath all the stuff you have. So again, this is just a difference. So decluttering. A major thing is that people think that bed bugs indicate cleanliness. But bed bugs are not discriminatory. They will be in the fanciest hotel or in a motel. And they doesn't mean if your house is clean or dirty, bed bugs can be everywhere. Again, just the clutter helps reduce their hiding spots. And the best measure, I think, as a housing department, if you're in a housing department, is communication out to the communities. So having education sessions. Because what we find is that people are scared or nervous to tell other people they have bed bugs, or they think they have bed bugs. And when they're hiding this, the issue can just become larger or more difficult to treat. So it's good to have a really good communication strategies within your communities, and so that they know people are there to help them as opposed to isolate them in their home. So using things like presentations, community websites, newspapers, sending out newsletters on bed bugs. And we have a couple info sheets if you'd like to take some home, or we can send up to your community to send out to community members so they're knowledgeable on bed bugs. If you're a housing department, again, what I've said before, if you think somebody has bed bugs, the best thing is to say, or to ask the occupant, or you yourself, is obtain a bed bug and send it to your environmental public health officer, and they can identify whether or not it's a bed bug or whether it's a different insect that may not be an issue. And housing departments should be aware that any pest management approach should be an all-inclusive approach. So meaning we may like to incorporate the health department, or health and social department, and making sure that we are working with the individual or the family that's affected. because I've had a time where an elder had bed bugs and all his things were taken away and burned, and he had nothing left. But he had bed bugs again, and he was scared to notify anybody because he didn't want all of his things taken away for a second time. So making sure that the occupant's on board and understands what's happening, and working with them. What are things that we can save? What are things we have to get rid of? And maybe working with the health department as well, because it can impact social or mental health when we have bed bugs. For housing departments, if they'd like to do their own inspection, you can use a flashlight. And again, as I said, they like to hide in, in dark spaces. So using a flashlight to find them. And then there's a couple methods to help monitor if you have bed bugs in a home. And these are, Amy's gonna pass them out. They're basically sticky tape that you can put around the leg of a bed frame or the leg of a couch. And it will inhibit the bed bug from crawling up, and will also stick onto the material. So then you'll just be able to see them better and know if you have them. Again, there's this small item. Again, it's glue in the middle, and you can put that in between a mattress and a box spring, and the bed bugs will crawl into it and get stuck. It's not going to alleviate the issue, but at least will help identify whether or not a home has bed bugs. And if you don't, these things are quite cheap. These things were $2 in Thunder Bay, and these little sticky guys were $1.99. But you can just use simple tape. You can also use Vaseline. Vaseline along bed frame legs will help prevent bed bugs climbing and also trap them, and will be able to identify whether or not you have them. There's also something called climb up interceptors. They're just plastic, almost like bowls that can be put underneath the leg frame. Again, capturing the bed bugs, inhibiting them from climbing up, and allowing you to identify if you have bed bugs. Another strategy for housing departments is vacuuming up, and we recommend using a bagged vacuum, so that's once you're done vacuuming, you can just throw away the bag. I know nowadays bagged vacuums don't exist, they're not as popular, but if you do use a non-bagged vacuum, making sure you're cleaning out that part that gets all the gunk in it, so that you know that no bed bugs surviving in that place and you're spreading them around. That's why bagged vacuums are better, so you know you're just taking that bag to the garbage once it's done. And yeah, vacuum, and making sure you have a vacuum that has a small nozzle to pick up all the small bed bugs and getting into small crevices and corners of the rooms. And the last thing I touched on briefly, so bed bugs don't necessarily have a physical health effect, but they can affect people mentally or socially. And a part of social determinants of health are the living situation of everybody. So a living condition, the social and material circumstances that people are exposed to in their homes, workplaces, and communities constitute a primary determinant of the health of the population. So the health of you is affected by where you live, how you live. So if somebody has bed bugs, the impacts on mental health like stress, insomnia, anxiety can be quite large. So making sure we are working with our health department and making sure that social isolation isn't happening. And so social isolation is if the person's not invited to come out, or you're inhibiting people from coming and visit that person, making sure we're including them in the prevention and the ways to get rid of them, making sure they're on board and understand what's happening so that issues don't become bigger. And that's the end of our presentation. So if anyone has questions, let us know. You can come. I'll take one of this one. It's off. It's off. I think so.
No. There.
Hi. So just one really quick thing. For the FNHC study, which you may have heard about this morning or yesterday, which will be a cross-Canada study looking at First Nations housing and nutrition and children, we'll be measuring radon across Canada. So we should have national data in First Nations communities.
That's wonderful news. And information about that study is online, correct? So that's the First Nations Environment and Food Study for children? Okay, so it's the second phase of the study, that 10-year previous study that was done, and there's going to be information online there as well, and it's cross Canada. So that's wonderful. Any other questions? Don't be shy. I know everyone's tired. Give us a call after. We have some resources, our cards, and have a great trip home. Travel safe.